If you are someone working in the ICU, then you must have come across this term called as PEEP, reflecting on a mechanical ventilator. Now, what is it and what are its functions? Let's talk. PEEP basically stands for positive end expiratory pressure, which means that even after expiration, there will be some amount of air which will stay inside the alveoli to prevent the collapse. Actually, our lungs already have a physiological PEEP which is between 4 to 6 cm of H2O, and because of this reason, when we are giving artificial ventilation to the patient by mechanical ventilator, we need to give some PEEP so that the airway can be maintained and it can be prevented from getting collapsed. In normal individual, we keep this PEEP between 5 to 6 cm of H2O, which is like physiological PEEP. But in certain conditions, we have to increase or decrease this. For example, ARDS patients have hypercollapsible airway and they need additional PEEP. And in pneumothorax patient, we need to reduce this PEEP to 0 so that we can prevent the leak of the air into the pleura. Now, to know more about PEEP, mechanical ventilator and ICU rehabilitation, read the caption and don't forget to follow Cardiopulmonary Rehab for more such informative videos and tips.